said that in this health care bill that abortions wouldn't be paid for. Is that what you?
There would be no federal money. There would be no tax money involved in abortions.
So we, all of us, will not be paying for abortions in any way. That's our money.
We've had what's called the Hyde Amendment for a couple of decades. It would prohibit any federal tax dollars being used for elective abortions. And this bill, that typically is on the appropriations bill. This bill, we actually put it in the language of the bill in an amendment. So,
one quick question. The other thing is, if we've got Medicaid that's out of money, Social Security that's out of money, the post office is not run worth a darn. Right. How can we trust you people? Medicaid is a federal state program. 67 or 68 cents of every Medicaid dollar comes from federal. The rest comes from the state. The state runs the Medicaid program.
How about Medicaid?
And they also run the S-CHIP program. And so, you know, the state of Texas does that. We don't run it. Medicare is a federal program. And you're right. Medicare, though, when it was created, was never actuarially sound. It was created to provide health care for seniors. And, you know, so seniors pay part of Part B, but we pay a Medicare tax right now. But most of Medicare's cost comes out of our general revenue that you and I send every April 15th, and that's what pays for Medicare right now. If it's bankrupt, it's our fault.
Why can't we do it all at once? Why can't we just take it a little bit? Why do they have to put stuff in the health care bill that none of us can understand? Just like Captain Paris. That bill was in markup till 3 in the morning. Nobody read the whole thing before I told you.
Well, you know, we're going to try and get our financial house back in order, but hopefully the economy will pick up. Let me get thank you for being patient.
Denver Harbor guy. So you put your guns up. Don't shoot me. If the Democrats are so bent on reducing health costs, why don't you put tort reform in the bill?
The reason tort reform is not in this bill is a number of reasons. First of all, malpractice lawsuits are not filed in federal court. They're filed in state court. The state of Texas in 2003, in a referendum, put tort reform in our state constitution. I have visited with lots of doctors. They're happy with our state law. Now, they may not be happy with Massachusetts or California, well, other states. But that's something the states have dealt with and can do it. The doctors in the last 2 weeks, they asked me, said, well, we're okay. What if Congress takes over medical malpractice tort law? You know, that could overrule any state law we have. It could even overrule our state constitution that's in there. And so, you know, in the state of Texas now, I have to admit, in 2003, they did the control on the caps and everything else. We didn't do insurance reform because doctors are telling me they're still paying high rates, even though their malpractice claims are going down because the insurance companies aren't being fair. And that's not the only insurance complaint they have, though. But that's why tort reform is not in here. I don't want to transfer that to the federal court system because then we change our state law. And it seemed like the voters voted for it, and I'm kind of hesitant to say the federal government should overrule that. That's why it's not in here. Now, you can control costs. That's one thing. And I have to admit, though, the state of Texas has it since 2003. Doctors are paying less in malpractice premiums, they tell me. But, you know, our insurance costs still go up. And, you know, we have in our state the highest number and the highest percentage of uninsured in the country. In the state of Texas. That's why it's a problem. So, tort reform won't get us out of that because we already have it in the state of Texas. Let me take one more. Yes, ma'am.